Hi, Dr. Sanjana with Castle Hills Family Practice. We are continuing with our series on different joint pains, and one of the most common joint pains, which is the leading cause of disability in America, is the lower back pain. Lower back pain is very common, and it happens due to people not exercising regularly, and if they've put on some weight, it may exacerbate the back pain. So our back muscles, which we call the lumbar spine, is made up of bones and muscles, and the muscles need to be constantly activated and exercised for the spine to be aligned properly. If we don't exercise the back muscles, then the spine can go, the bones can go out of its sync, and therefore the discs can kind of be moved out of position easily, especially during a jerky movement or lifting, pulling, pushing something heavy. So when that happens, typically it can give you lower back pain, which can be limited to the lower back, or it may run down the buttocks and down into your legs, what we commonly call sciatica. So it's a very common problem in young and older people, and it is more seen in people who don't exercise regularly and who do exercises or do strenuous activity sporadically. Again, like most of the musculoskeletal conditions, it can be treated if it is caught early on time with the help of anti-inflammatory, muscle relaxants, resting, and exercise. Physical therapy comes very handy in this because we see conservative treatment with physical therapy helps almost 70 to 80% of our patients within as little as a month. If, despite doing physical therapy and anti-inflammatory and muscle relaxant, patients don't get better, then we have to order MRI to find out what's going on and maybe refer the patient out for pain management or surgery as a last option. There are some warning signs for lower back pain which we tell our patients that they should not wait when that happens. If a person is more than 65 years old and has sudden onset back pain, then that is considered high risk because these people are at risk of fracturing their vertebra, and sudden onset back pain should not be in that case treated conservatively, but at least some imaging done to make sure they don't have a fractured vertebra. Another warning sign is numbness in the saddle area. If a person comes in and says they've had chronic back pain and they have numbness in the saddle area where they can't feel anything in that area, that is a sign of a serious pinching of the spinal cord, and that might need a surgical evaluation immediately rather than conservative treatment. Also, when somebody tells me that they have back pain with fever or back pain with loss of urine or bowel control, those are very big red flag signs which we do not treat conservatively but might need to do investigation immediately and referral to the surgeon or emergency room. So again, if you're suffering from back pain, which is a common problem, come see us. We can help 80-90% of the back pain with conservative measures and exercise and simple medications.